Hi, everyone. My name is Jessica Rino, and I am a clinical social worker and the clinical director at Mightier. I'm going to give you an overview of the Mightier program and a number of different parts of our program. This is specifically designed for professionals, therapists, school counselors, special education teachers, occupational therapists, anyone who is looking to use Mightier in a professional setting. This overview is for you. I'm going to take you through the different parts and hopefully answer a number of your questions ahead of time if you are considering using Mightier. So we like to say that at Mightier, this is mental health care really designed for kids, and also built for community. I will explain a bit more about what that means. The age group of kids who can use Mightier, we are looking at 4 to 17. There are a number of different games within the Mightier program that make sure that this is relevant for that large range of kids. And also at this point, Mightier is in 8 different languages. So if you are working with children who English is not their primary language or their caregivers are not English speaking, we have a number of different languages that we support as well. So a quick overview of how very high level around what Mightier is. So Mightier is a therapeutic program that helps children explore their emotions, practice and build coping skills through play. Everything we do at Mightier is through play. The core of our program is a biofeedback video game, and then we have a large number of therapeutic activities, all play-based, that really wrap around the program as well. Mightier was born out of Boston Children's Hospital and Harvard Medical School. And we have a strong science background, a number of randomized controls trials, and ongoing studies that we have conducted over really the past 10 years, looking at how Mightier is impactful, how it is effective for different populations of kids in different settings. So if you're interested in any of our science beyond what I share here, you're welcome to explore our site or reach out to our family care team to really dig into that and what's available. So high level, Mightier is a biofeedback video game. It is not medication. It is not a pharmacological intervention that is used. Oftentimes, kids are put on medication to manage their behaviors. Mightier is a tool that is actually going to teach kids the skills to help them manage their emotions, manage their behaviors, build that skill of emotional regulation. We have really strong clinical outcomes and engagement. So across the board, not looking specifically at like different populations of kids or diagnoses, 87% of all children show improvement within 3 months of play. I am going to break that down a little more specifically in a bit. It is a fun and engaging program. Again, we use play for everything we do. When kids play Mightier at home, because that is an option with our program that kids are playing in their own home. 60% of children continue past 1 month of the program completely on their own, which when you look at engagement rates for digital interventions, that is very high in comparison to other things. It lowers cost of care. So we actually have an NIH study that is wrapping up right now. So preliminary data is showing that when kids play Mightier, there is about $1,000 in their overall behavioral health care saving costs saved, like within a year out of play. So Mightier, again, like is a lower cost intervention and also reduces total cost of care. We're specifically looking at outpatient therapy costs, pharmacy cost, cost for higher level of care as well. And relieves burden on the clinician network. So if you, as a clinician, right, and my background is in therapy, you can only support so many kids as a clinician. So when we introduce Mightier as a tool into the system and it's able to support kids around their emotions and build coping skills and build that skill of emotional regulation, it does relieve the clinician network in a way where you can focus on kids who maybe really do need that one-to-one support, but who you're just not able to support when you have a full caseload. So when we look at our family programming, and this is also how this looks when you translate this into a professional setting. So we have the core of Mightier, and that is our kid programming. So that is our biofeedback video game. Kids are wearing a heart rate monitor as they play. They play just 45 minutes a week. There's some flexibility in that, especially if, a child's playing in school or something like that. But in this gameplay, kids are navigating worlds, exploring their emotions, practicing regulating, bringing their heart rate down. That is like the core of the kid experience. We also have this like family or community experience where these are our hands-on activities that really bring therapeutic programming to life. These are crafts, games, stories that get you to explore different themes. It could be anger, could be perspective taking, could be how to understand negative thoughts and practice cognitive restructuring. So a number of different themes that we explore through really tangible methods that are a fun, open up conversation, really approach this in a different way. And then we have the caregiver side of our program as well. This is called Mightier Parent. This is another app where parents or professionals who are supporting a child in their play can follow along with a child's gameplay from their side. So you can see what games a child is playing, how many times they're bringing their heart rate down, the achievements within game. There's also a bunch of psychoeducation in there around what a child is doing in Mightier and what that means, how it translates to emotional regulation learning, and also just like general mental health concepts that are explored there as well, and strategies, things like that. So let me talk a little bit about the core of Mightier. This is our mechanism. So when we think about emotional regulation, so you think about a child who gets angry, gets anxious, they get to that point where they don't have control over their emotions anymore, right? They are kind of flooded, they're reacting. And it doesn't matter oftentimes if we have talked about how we feel and why and what we should do when we are angry or anxious, right? We've worked with those kids who they're in the real moment and like all their coping skills go out the window because their brain is working differently, right? They are oftentimes in that fight or flight mode and they cannot access that information that would help them know how to manage their emotions and behaviors in that moment. When kids play Mightier, they are practicing emotional regulation in real time. As they play, they wear a heart rate monitor. That means their heart rate is connected to the gameplay, and the game responds to what's happening with a child's heart rate. So when you are calm, the games function normally. And then when your heart rate goes up into your red zone, and this is personalized for every child, when your heart rate goes up into your red zone, the games become more challenging. And there's a lot of visual cues and auditory cues to let kids know they're in the red zone. If you look on the screen right now, you can see these little red creatures coming out from the sides. These are our lavalings. They let you know you're in the red zone. Now, at this point, you want to get your heart rate back down. You want to get back to blue. Mightier is going to prompt you and teach you how to do that. You can follow along with that if you would like. You can pause the game, follow along with the calming strategy, or you can keep on playing and bring your heart rate down at the same time. Either way is great. But what this does is it gets a child to practice emotional regulation again and again and again. Kids have to bring their heart rate down again and again and again. And if you think of any skill that takes practice to build, shooting a basketball under pressure, playing the piano when you're anxious, this is exactly what's happening for emotional regulation. So when kids have played, and again, 45 minutes a week, around the 2 to 3 month mark is when we start hearing, I can notice that this child is a little calmer. Their frustration tolerance has improved. They're calming down more quickly on their own. They are better able to intentionally use calming strategies in real life. So that's when like the practice that's happening in games starts translating out to real life, and you start seeing those signs of like, wow, this child has really built emotional regulation skills in a pretty meaningful way. Here is just an example of a couple of our calming strategies that kids are exposed to. We try to make things cute, interactive, fun to follow along with. So here's our deep breathing and progressive muscle relaxation. There are some other calming strategies as well that kids are going to be exposed to and get to play around with, actually like interact with as they play. Now, I had mentioned that like across the board, when we like just look at all kids playing Mightier, we see that 87% of kids are making improvement within that 3-month time frame. When we break that down by category, so kids like really struggling with anger, so possibly diagnosed with ODD, possibly reactive attachment disorder, but like really like anger is like the primary symptom they're struggling with. We see really great improvement there. So specifically, anger, frustration, aggression, if that is what is happening for a child. So those externalizing behaviors, um, anxiety as well. So when anxiety is a symptom that a child's really struggling with and it uh, gets in their way in life, we do see improvements in those internalizing behaviors. So anxiety, worry, withdrawing, low self-esteem, we see improvement there. And then when a children do not necessarily need a behavioral health diagnosis at all to play Mightier. But for kids who do carry a diagnosis, so say a child has ADHD, which we know that ADHD can make it much more difficult to manage emotions, regulate emotions, right? Um, we do really see great improvement for this group as well on that anger and anxiety front, but also in terms of impulsivity and hyperactivity. And then for kids diagnosed with autism, this we actually a couple years back ran a small pilot with Magellan Healthcare where all the kids in the pilot had an autism diagnosis and were receiving ABA. And then we gave Mightier to half the group as well. And what this showed was that for kids where who were demonstrating like aggressive behaviors, we saw twice the reduction in aggressive behaviors for the kids playing Mightier. And then also we saw greater symptom improvement for the kids playing Mightier as well. So across the board really helps kids build this skill, this core foundational skill of emotional regulation. But if you have a child who is struggling more with that because of a certain diagnosis, can also be a really great tool for them as well. And then in addition to sort of this core piece of emotional regulation, there's a lot of therapeutic learning that is happening as kids play Mightier. So kids are navigating different worlds. They're going on quests. They are solving mysteries. They are playing these other little micro games that are, teaching them different therapeutic concepts. All of this is pulled from cognitive behavioral therapy. I'm going to give you a few examples of what this looks like. So one of the worlds that kids go explore is Green Valley. In Green Valley, there's a forest full of mysterious emotions and upset animals. You have to figure out what's going on. What this is doing is it is really helping kids identify and name emotions. Kids have to use the concept of energy and valence to figure out what's happening within this world and what these different emotions, these like mysterious emotions are. So kids are learning how to understand emotions in terms of energy and valence rather than just like a simple scale of like trying to put like happy to sad and angry on some sort of like one, linear scale, which is not how things work, right? We have to think about the energy level in our body. We have to think about how something feels like in terms of whether it's pleasant or unpleasant. So this is really helping kids learn that and explore it. So there's a whole narrative there that kids are going through. And then there are also some specific games that get them to practice these skills. So on the left, you see we have this little emotion builder game that's happening. This is really where you're exploring that and learning about energy and valence. And then there's a self-application piece happening here as well. So when kids log in, there's like a daily check-in that you go through, and you're really just like reflecting on how you feel. But this is getting kids to reflect for themselves and apply this skill to themselves. And kids earn a little prize after they play. That idea of like there's an economy within Mightier. Kids are always you're leveling up, you're collecting coins, you have a little creature, an animote, and they are growing. There's a lot of game design pieces here that keep this really engaging and fun for kids, so that kids feel like, okay, like I'm progressing here and I want to come back. Which is really important. The engagement piece is really important because if kids don't find Mightier engaging, they won't play, and therefore they wouldn't, there would be no clinical benefit here. So it does matter that this is fun, and kids want to play and feel motivated and empowered with it. The next world, I'll just give you a quick preview, is we call it Red Mesa. This world is really focusing on anger, but also interoception. So like, let's really tune into like those body signals. How do our emotions feel within our body, which we know is a skill that actually kids with ADHD and autism struggle a little more with. Like that awareness of like, how does my body feel is something a lot of kids really struggle with. So we're gonna really dive into it. And it's fun here. The world itself is, you know, showing body signals, land signals, and you have to figure out what's going on. The uh, little learn by play game happening within this world is an interactive body map, where you have to kind of scan it and figure out what's going on. Okay, and so there are other worlds in there as well, but just going to show you those two. So who is Mightier right for? So again, kids 4 to 17 who struggle with emotional regulation. On the younger side of this, 4, 5, 6-year-olds, they're going to need a little extra help to play. They're going to need someone to probably help them put that heart rate monitor on, figure out how to navigate the video game, what buttons to press, things like that. So you're going to need to support them a little more there. But otherwise, like kids can be pretty independent with it. You don't need to necessarily sit with a child as they play Mightier. They can be independent with that. You're going to think about symptoms around emotional dysregulation, like kids, this child really could improve with frustration tolerance. They get really angry, anxious, things like that. There are a number of diagnoses that we often see emotional dysregulation paired with. And then the only thing I would say is if a child has some sensory sensitivities, textures, and specifically around like wearing things on their arms. Honestly, it would not mean they can't play Mightier. You just might have to pay attention to like, okay, like is that heart rate monitor going to be comfortable for them? And we can get creative with how to make sure that it's a comfortable experience. And our family care team has a lot of good ideas around how to make sure that feels good for kids. This is just alluding to a study we did a number of years back where actually kids who are playing Mightier in school showed a number of behavioral improvements, specifically more time. There were a lot of disruptive behaviors, right, that were happening for kids that meant removal from class. It could have been aggression. It could have been verbal outbursts, depended on the child. But when kids played Mightier, their time in class increased. And this was actually a short study. I believe this was just 8 weeks long, I believe. So now you also have some professional programming available to you with Mightier. So we have our therapeutic curriculum and we have our skill packs. Skill packs are actually designed for families, and I had mentioned those at the beginning. They are something you can actually send home with a child to like extend their learning home and bring a family into the fold a little bit and give a whole family a chance to like talk about emotions, explore a concept together. But I'm going to tell you a little more now about our curriculum option. So we have 5 units built out. We wrap everything in a metaphor. So our super sensor unit is all about sensory awareness and mindfulness. Our garden of thoughts unit is about managing unhelpful thoughts. Ocean of emotions is really about affect labeling and like exploring mixed emotions. Our signals from inner space is about interoception. And then the power of perspective is about seeing other points of view. I'm going to give you a quick overview of what one of these looks like and give you some examples. So we're going to look at our Ocean of Emotions curriculum. So again, this is like exploring mixed and complicated emotions, identifying emotions. So in each of these units, there is an overview for you, uh, the professional, around like what is this unit about? What is the therapeutic value? What are maybe the therapeutic or social and emotional goals? Outline of the activities, and then like the materials you're going to need. We have a range of, we want to use art, we want to use different modalities, right? So we want to use art, we want to use movement, we want to use a variety of creative expression, right? So we want kids writing stories, coming up with ideas. So there's a lot of different ways that we're going to get at this. And then we want to give you the research behind all this as well. Here's an example of one activity. This is deep sea sorting. So again, I mentioned we're using the metaphor of like the ocean. So in here, there are a bunch of different emotions that you're going to cut out. And then there are going to be different prompts. And kids are going to order these emotions based on like higher, close to the surface, or like lower, deep down. So the prompt might be, which emotions do you let people see? Or it might be, which emotions do you enjoy feeling? And you're going to let kids rank those, and it's going to open up conversation. This could be an individual or a group activity, because it works either way, and it really like allows for conversation here. You could make some variations in this depending on like age group. You don't have to use all the emotions if you don't want to. Another example, we call this Sangri Narlugas. This is just like a really fun, goofy way to mash two emotions together and then figure out what they are, because we do feel two emotions at once all the time. And then let kids come up with their own. Let kids like make that funny word, emotion combination word, and draw it. What would it look like as a sea creature, right? So just like trying to make this stuff fun. Again, we have some stories. There's always like a little lava character with a bio, and then we really like comic strips. So letting kids come up with their own comic strips. This is our fishing for feelings game. You're going to make a little fishing hook and hook the feeling fish and name a time you felt two of these feelings at once. And it's a game, and you're going to keep track of points. So again, could be individual, could be group activity. And then so that's a quick overview of our curriculum. I'm going to give you some tips for implementing Mightier. So Mightier is really ideal for tier 2 and tier 3 interventions. So Mightier itself, like the biofeedback game, really ideal for tier 2 and tier 3 interventions. So individual or small group, not ideal for whole classroom use. Just in terms of the technology, would be a little difficult to manage. But if you regardless of how you're interested in using Mightier, you should talk to our family care team, and we'll talk it through with you. We recommend 20 minutes of play each session. Practice is really key here. You could put it in a calming corner as a tool for behavior, or like a behavior management tool. Different staff members could set kids up to play, but kids can play independently. And you can have kids play on or off Wi-Fi, depending on like your setting and what's easier there. The Mightier offline curriculum, so our therapeutic curriculum, really can be used across tiers in individual or small group or even whole classroom settings. Now, if you are interested in piloting Mightier, and because we have had people who in organizations who have done this, I'm going to talk through a model that has worked really well for a Boys and Girls Club in Indiana. So what they have done is they use an assessment to identify who's eligible for Mightier, and then they enroll children into their Mightier program. And they gather some baseline data. They use the strengths and difficulties questionnaire. You can use whatever you're comfortable with. And then they have the child play Mightier 2 times a week for 3 months. And then they gather post-intervention data with that same assessment. And then they either like re-enroll the child or they transfer the license to another player. So this model has worked really well in terms of gathering data and keeping play really structured, in that this child is going through the Mightier program, they're enrolled, they play for 3 months, and then we transfer that license to another child. It's a nice organized way to keep track of things and move kids through. And then I'll leave this up for a second. We have our family care team who's here to answer any questions you have, figure out any purchasing options, equipment, whatever you need. Our family care team is really the best to talk to about that. All right, I hope this is helpful. But again, reach out to our family care team if you have any questions about Mightier. Thanks so much.